This question is indicating gravida 2, para 2. Mother is current conceive or pregnant, and the patient is anxious and concerned regarding pregnancies, and nurse provides genetic counseling. Which food would be effectively prevent cleft palate? Basically, cleft palate and cleft lip is because of congenital thing. It can be occur as a result of folic acid deficiency. Folic acid deficiency can happen, or folic acid deficiency causes cleft lip palate as well as neural tube defect, spina bifida, Down syndrome, all those things, and meningomyelocele, all those things. So it can, or cleft lip and palate is because of folic acid deficiency, and folic acid is rich in this. Folic acid is rich in green leafy vegetables and citrus. Please tell me, B is rich of what? B is rich of calcium. Okay. C is rich of
carbohydrates.
Yeah, carbohydrate. Yes, exactly. Carbohydrate and protein. Basically, the content of protein is gluten. C is having, yeah, it's high rich of gluten protein. And D is, yes, it's beef is iron, chicken is protein, yellow vegetables are vitamin C. Vitamin C. Okay. You will get 10 questions from diet. Okay. So remember this. I want everyone to write down. Number 1 is gluten protein are not permitted in 2 conditions. Gluten protein are not permitted, or it should not give in 2 conditions. 1, celiac disease. What is celiac disease? It is a disease in which gluten protein is not able to digest. So it's celiac disease. Celiac disease. And second is villus atrophy. Villus. Villous. Villus atrophy. Villus atrophy is inflammation of the villi. What is villi? Villi is the small projection which is found at the small intestine. So gluten protein, because it will irritate the small intestine. Okay, gluten proteins irritate small intestine. Clear? Villus atrophy and celiac disease. Villus atrophy is an inflammatory situation of villi. Villi, it is a small projection at the small intestine, or inflammation of the small intestine. In these 2 situations, you are not allowed to give gluten. Okay, fine. And iron, the 4D option is given. D option is given to treat anemia, basically iron deficiency anemia. D option. D is given to treat iron deficiency anemia. Okay, next question. The nurse is educating a diabetic mother on a symptoms of which of the following symptoms stated by the mother indicate education was effective. So this is symptoms of hyperglycemia. hyperglycemia. There is a typing error. So hyperglycemia. What is the sign of hyperglycemia? Polyuria can be a sign of hyperglycemia. Yes. Blurred vision can also be a sign of hyperglycemia. Dry mouth can be flushing. All these. But the like very important thing. See, I'll give you clue and key. Okay. When you get these kind of options, like which of the following is most effective? So all these are a sign of hypoglycemia. Sorry, hyperglycemia. So you have to ask each option. This problem will kill the patient or not? Okay. Do this problem kill the patient? Do polyuria kill the patient? No. Blood flushing? No. Blurred vision? Blurred vision is also not killing them, but blurred vision is indicating the real vascular problem towards the brain. So that is a major thing. Dry mouth, it is not going to kill the patient. So the very important thing is C. So when you feel this kind of key, or when you this kind of the situation, you can use this key. You can ask options that is this problem really damages the patient. Okay. Next, a woman was discharged from gynecological ward after gestational trophoblastic disease of molar pregnancy. What is this molar pregnancy? Molar pregnancy, otherwise is called as trophoblastic disease, or otherwise called as HMOL or high datadiform mole. Okay, I repeat, trophoblastic disease, molar pregnancy, high datadiform mole, and HMOL. What is this? What is exactly molar pregnancy? Molar pregnancy is very simple. Okay, so molar pregnancy is very simple. It is after, so after conception, the product of viability is, it has to divide and it has to grow and it should become a fetus. But in molar pregnancy, what happens, in molar pregnancy, the product of viability is not dividing. It is forming. This is not forming a fetus. So molar pregnancy, it is like, see, this cell and this is another cell. These two has to join together and it should form joined cell. This is called a zygote, and the zygote has to grow further and further and it should form blastocyst, and then from blastocyst it has to produce chorionic villus and placenta and then fetus. Okay, but fails to form a fetus and placenta, it continuously divide and it forms a cluster of small tumor is considered as a molar pregnancy. Okay, so so what is the answer? During discharge, no, which advice you will give? Avoid falling pregnant for at least 1 year. Yes, that is the answer. So yes, this particular point is very important. It is applicable at the point of discharge for molar pregnancy, after D&C, for abortion. All these situations, D option is very important. What investigation is? What is the investigation to identify molar pregnancy? Investigation is HCG. So which HCG? Urine HCG or serum HCG?
Serum HCG.
HCG need to be assessed. It should be urine or serum?
Serum.
It should be serum. Blood. Send blood for HCG, which will be expected 3 times greater than the normal. Clear? Okay. And tell me the fundal height is increased or reduced than the normal? Fundal height will be always increased greater than the normal expected gestation. Okay, fine. And yes, what is the finding in USD? In USD, snowstorm, grape-like cyst or snowstorm appearance, and sometimes this grape-like particle will come out through the vagina. Okay, so in molar pregnancy, investigation is HCG, serum HCG and ultrasound. Serum HCG will be 3 times greater than the normal required, and ultrasound shows snowstorm appearance, and sometimes it comes out through the vagina. Fundal height will be always greater than of normal expected gestation. Okay. Next question. Which of the following statement describes latent phase? So yes, latent phase is A. Fine, very good. Next. 22-year-old Gravida 2 para 1 with gestational age 38 week was admitted to the hospital, and the chief complaint is decreased fetal movement. Non-stress test revealed decreased variability and normal fetal movement. Next morning, as a part of antenatal checkup, the nurse checked the fetal heart rate, which revealed 100. Is this normal? No.
No.
Which of the following action the nurse should do first? Reassure the mother that this fetal heart rate is okay, wrong. Notify can be. Reposition the patient into left lateral and recheck, that is also okay, not wrong. Ask the mother about the pattern of, no, that is not good. So there are 2 options. So the answer is yes, it is B. 100 is indicating deceleration of heart rate. What are the reason for deceleration? Tell me. What are the reason? There are 3 types of deceleration. Late deceleration, early deceleration, late deceleration, and variable deceleration. Okay. So what is the reason for variable deceleration?
Cord prolapse. Cord prolapse.
Cord prolapse. Very good. So what is the reason for late deceleration? What is the reason for late deceleration? You can just, at least you can turn your pages and tell me.
Hypoxia.
Transplacental hypoxia. Okay, placental hypoxia. And what is the reason for early deceleration? Early deceleration. It is fetal path. No, not fetal path. It's like a passageway, a compression of the passageway. Clear? So there are 3 deceleration: early deceleration, late deceleration, and variable deceleration. Okay, so when we take deceleration, and then we'll discuss again. So there are 3 types: early, late, variable. So which one is okay deceleration from this? Which one is indicating okay deceleration from this? Early deceleration is not a problem. Late deceleration is a problem. Variable deceleration is a big problem. So late deceleration is because of decreased oxygenated blood supply to the fetus. So you can just provide a left lateral position and administer oxygen will solve the problem. Variable deceleration is because of? So variable deceleration is because of umbilical cord prolapse. Okay. What is the position or what is the suitable position for umbilical cord prolapse? Which position you would provide for the patient?
Head low
You can,
position.
exactly, you can provide a head position. Okay. If mother if mother says, I have tried to replace the cord, it's true or false? It's a false statement. Never ever try to replace it back. And the last question is the relative. Okay. Sorry, this is the last question. Nurse is planning to discharge a non-case of HIV at the isolation unit after recovery from upper respiratory tract infection. Which of the following is the nursing problem requires to select? Risk for infection due to altered immune, fluid volume deficit, anxiety due to disease, and weight loss. Which one is a proper nursing diagnosis related with the HIV? It is a risk for infection due to altered immune. Okay. Okay, so this is all about question discussion. If you have any queries, you can clear.